Welcome, families, to this gentle, supportive explainer. We're going to be learning all about caring for a child on pediatric steroids. Now, if you're watching this, you're probably navigating a brand new diagnosis or a treatment plan for your little one, right? So first, let's just take a collective deep breath together. Medical journeys, yeah, they can feel totally overwhelming, but knowledge is absolutely your best tool. Today, we're going to break the whole shebang down so you have a crystal clear map of exactly what to expect. We have a really clear game plan today. We'll meet your body's shield, talk about taking the medicine safely, understand the side effects, build some healthy habits at home, cover when to call the doctor, and finally remind you that you are not alone. All right, Section 1, meet your body's shield, understanding steroids. So when you're first starting this journey, the biggest question on your mind is probably, okay, what exactly do these medicines actually do inside my child's body? You know, the word steroid gets thrown around a lot in pop culture, usually in some pretty confusing ways. But in pediatric neurology, it actually has a highly specific, deeply healing purpose. I want you to think of them as a gentle, calming shield. See, sometimes the body's immune system gets, well, a little confused. It becomes overactive, setting off internal alarms and causing swelling or inflammation inside the brain, the nerves, or the muscles. Steroids are these special medicines designed to literally step in, calm those alarms right down, and put out that fire of inflammation so your child's body can finally start to heal. Doctors rely on these for a few really crucial reasons. Mainly, they're prescribed to treat autoimmune or inflammatory conditions and even certain seizure-related issues. By acting super quickly to calm that swelling down, they help improve those symptoms so much faster. And honestly, most importantly, they protect your child's brain, nerve, and muscle function. And don't worry, your medical team is going to be carefully monitoring this entire process to make sure it's doing exactly what it needs to do. Moving right along to Section 2, taking the medicine safely, the journey. Now, depending on your child's unique needs, this medicine can actually be given in a couple of different ways. If your kiddo is in the hospital, they might get IV steroids safely through a tiny tube in their vein. This is great because it lets the medicine work incredibly fast. On the flip side, maybe you're transitioning out of the hospital or starting right at home. In that case, you'll likely be giving it as a simple, easy-to-swallow syrup or a tablet. Okay, listen up, because this is the absolute most crucial point. If you only remember one thing today, let it be this. You have to follow your doctor's instructions perfectly and never ever stop giving the medicine abruptly. Why? Well, because steroids actually mimic what the body produces naturally. So the body needs time to slowly, gently wake its own systems back up as the medicine is reduced. Your doctor is going to give you a super clear, step-by-step weaning plan for this. Since steroids are quite powerful, doctors usually prescribe a little team of friendly sidekicks to help support your child's body along the way. This might include a stomach protector, like a PPI, just to keep their tummy nice and comfortable. You might also see vitamin D or even calcium supplements on the list, and those are just to make sure their growing bones stay strong while they're on the treatment. All right, up next is Section 3, understanding side effects, bumps in the road. Like any medical journey, there might be a few bumps in the road, what we call side effects. It is completely 100% normal to notice a few changes in your child. Like, you might see their appetite shoot way up. Seriously, they might act like they're hungry all the time. You might also spot some mood swings, maybe some extra irritability, or even a little difficulty sleeping. Physically, their cute little face might look a bit puffy or mildly swollen, and they could have some minor stomach discomfort. All of these are just super common signs that the medicine is in their system doing its job. But here's the really bright side. Take a deep breath and know that most of these bumps in the road are entirely temporary, I promise. As your medical team safely dials back the amount of steroids your kid is taking, those side effects, they'll just begin to fade and improve really quickly. Plus, your doctors are keeping a super close eye on everything to keep your child as comfortable as possible. Okay, let's look at Section 4, healthy habits at home, the home base. This is where you get to take charge and put on your superhero cape with some everyday habits. You can build an amazingly strong home base with just 3 simple steps. Step 1, fuel their body right. Because steroids can ramp up appetite and cause a little fluid retention, giving them healthy, low salt and low sugar foods along with a ton of water is an absolute game changer. Step 2, protect their rest. Steroids can sometimes make sleep a bit tricky, so having a strict, really calming bedtime routine without any late nights is essential. And step 3, be a hygiene hero. These meds gently lower the immune system, which means your child might be a bit more likely to catch a bug. So washing hands like a pro and staying away from sick folks is going to be your absolute best defense. Oh, and one really quick but absolutely critical note on keeping that immune system safe. Always, always talk to your doctor before your child gets any new vaccinations. While they are on these high-dose steroids, certain live vaccines will actually need to be delayed just to make sure everything stays perfectly safe and effective. Which brings us to Section 5, when to call the doctor, the lifeline. You are doing an amazing job managing things at home, but it is so important to know your lifeline and exactly when to call in the experts for backup. I want you to mentally screenshot this list right now. You need to seek urgent medical attention if your child ever develops a fever, which can be a sign of a serious infection. Also, call for help immediately if they're having any trouble breathing, if they show severe or unusual weakness, if they have persistent vomiting, if they are severely sleepy and you just can't seem to wake them up, or if you notice any really significant, alarming behavioral changes. Look, you know your child best. If your gut says something's wrong and you see these red flags, your medical team is standing by, ready to help. Finally, we have Section 6, You Are Not Alone resolution. As we wrap up our explainer today, I really want us to take a moment, step back, and look at the big picture. You are doing a wonderful job, and most importantly, you are not navigating this path alone. I really want to leave you with this reassuring truth. Many, many children take pediatric steroids safely every single day to overcome some really tough neurological conditions. And your medical team, they're going to be right there to support your beautiful family every single step of the way, guiding you through the dosages, the side effects, the whole healing process. So as you step back into this caregiving role today, armed with all this new knowledge, I want to ask you, what is one small, healthy home habit you can put into practice right now to build that strong, comforting foundation for your child's recovery? Thank you so much for joining us, and take good care.